lives, and tonight we've chosen a very current topic of how things are going in lockdown with our pets, and we have been joined by the absolutely brilliant Professor Stuart Carmichael. I'm going to pass over to Stuart now just to give a little bit of an introduction about him to us, if that's okay, Stuart.
Okay, yes, thanks, Esme. Yeah, well, good evening, everyone. My name's Stuart Carmichael. I have been a vet for longer than I care to tell. Qualified in '78, but I've been an orthopaedic surgeon all of my life, mainly working with small animals. And my kind of passion about 20 years ago became osteoarthritis. And there's lots of reasons for that, because osteoarthritis, I found, was one of the things that really frustrated us. And the more I looked into it, the more I learned about it, the more I realized there was to learn to understand. So I'm delighted to share some of my problems with you and maybe get some answers from you.
Well, hopefully. Who knows? Brilliant. Oh, thank you so much for being here with us. It's a pleasure to be able to speak to you tonight. So I guess we can get straight into it, really. Obviously, we've all been hugely affected by the current crisis. I know myself, I've been furloughed from my vet work, so I've not done any veterinary for nearly 2 months, which is very bizarre. And I've just started doing a little bit of acupuncture, and that's it. So it's been very strange times, and I know that you know, I've definitely been affected with the way that I manage my dogs at home, and neither of them have arthritis, but even just a normal, you know, healthy little dogs, that's changed a lot. I'm sure you've been quite affected too, haven't you?
Yeah, and I think, I mean, I've my own dog, I think we were discussing, my own dog has arthritis. I've got a 9-year-old flat coat retriever. Fortunately, it doesn't really cause her much of a problem, and we can maybe talk about that, because I think that's a really good point. Yeah. And again, when we were thinking about what we were talking about tonight, that's what was in my head. I thought, well, what would people be worrying about if they knew their dog had arthritis and they were sitting at home and trying to do the best? But, you know, what is the best? How can you actually be sure that you are doing the right thing and try not to worry and panic too much?
Yeah. And I think, well, this is going to be one of these talks really tonight where anybody watching, please join in with comments or questions, because, you know, we're all being affected in many different ways, and it will be interesting to get some differing opinions on that, really. So what do you think the main things that owners are worrying about are?
Well, I mean, I guess, and I'm just going to have a stab and a guess at this, because, and hopefully people will tell us throughout this what they are worried about. But I would have thought that the main concern would be, is my pet in pain? Yeah. And kind of, that's one of the things I wanted to talk around. You know, what pain means. What pain's like in arthritis. So because I think if we understand that, I think it makes it much easier, and it's less of a worry when we look at what's happening in pets. And then I thought we could talk about a little bit how we recognize the different types of pain, and really when you should worry, when you should seek attention. Because I think one of the things about having an arthritic dog, and it is that, you know, as vets we can help a lot, but we rely on the pet owner to do most of the work, in the sense that they can see the dog all of the time. We can give them the tools and the information, but it's really up to them. That works best if the owner is the main carer and knows what to do. And I think the theme for me is confidence and control tonight. You know, if you're confident, and if you feel in control, you're probably going to be doing a good job.
Yeah, I think you're right, because, you know, when you're, as a vet, often the dog is either a little bit anxious or a little bit excited when they come into the vets, and they can show themselves not to look that bad. So we see a very small snapshot of their life, don't we? The small part of what's going on. And obviously we do tests, and we we work them up, and we check things, and we can get a bit more of a gauge once we start manipulating joints and things and seeing, okay, what's his reaction to that. But they still have adrenaline that they don't normally have at home. So you are right, we can help to some extent, but it does totally rely on the owner knowing what's best for their dog and what's working and what's not working, and us communicating with them and having that really good relationship to do the best for that pet.
I think, and one of the things about pain, it's always a worry, because I think much of the time, I think we spend trying to convince owners that dogs have got pain, because there seems to be a big blind spot in many owners where they look at things and they don't realise that what the dog's showing is pain. Yeah. But in the other sense, it's kind of knowing as well when pain becomes a problem, a real problem that we have to do something about, and when we can actually take our time and still cope and manage with the whole thing. I mean, I think that we've got to borrow a lot from the human experience in arthritis with this, because unfortunately our dogs can't tell us what they feel. But the more and more we understand how the dogs are wired exactly the same as we are, we realise that the pain experience and the arthritis problems they have are probably very, very similar to what we experience ourselves. And I think that helps in trying to understand the disease and the problems they're having.
And I think that the understanding of canine behaviour is growing and growing and growing. So we are able to recognise signs of or changes in behaviour that could be indicators of pain that maybe we used to put down to just old age, or just the dog's just changed for some reason. And now we can think, okay, well, dogs don't just change for no reason. They don't decide one day they just don't want to go on a walk for no reason. That's they just don't work like that. So I think it's we're lucky, because it's a time of veterinary where the understanding of pain and arthritis is growing and growing and growing. Well, we're lucky if you're interested in arthritis, I should say, like us.
Why shouldn't you be?
Yeah, well, no, it's brilliant. I've just, before we move on, Rosemary's just said, how useful are videos from the owner to you as the vet? So we're talking about that recognition of pain and seeing the dog's snapshot at home. What would you say to that?
I think that it's one of the things in lockdown that we've perhaps exploited a lot more. And I think the straightforward answer is hugely useful. And I think what we need to do moving forward is we need to kind of get almost a set standard, so that an instruction is, this is how to take a video. This is what's really useful for me to see. And I spent many hours, and having worked a lot of time in Scotland, many hours in the rain, chasing dogs up and down car parks when they refuse to show what the owner's concerned about. And I think the big advantage of having a nice video is that, firstly, the owner, if they've got a worry, they can capture it exactly, and then we have it. And it saves us all time, and we can get straight towards analysing what that particular gait means, because sometimes it can be something completely different. And one of the other things that's really useful, I mean, it's a strange thing to say, lameness is so important when we look at arthritis, but looking at lameness is kind of an art, and it's an experience. And we can tell straight away from a video which leg the dog's lame on, which seems a silly thing to say, but so many times, if you don't know what to look for, you think it's actually the sound leg that's lame. Because the animal tends to put all its weight onto that sound leg and drops on it. whereas it holds itself up in the lame leg. And that's a good starting point, because so many times I've seen vets spend a lot of time looking at the wrong leg because they haven't been able to see the lameness properly.
Yeah, because when you're in a GP clinic and you're just seeing them in your consult room, you haven't always got that space to do a proper, you know, in a fine practice, it's very normal to watch a horse run up and down all the time. But in small animal practice, that isn't the norm, unfortunately. And you're absolutely right. Seeing them in motion is great, and people do slow motion as well, so that can be really helpful to see the little changes. And yeah, I found it quite useful with my patients. And I also think from a monitoring point of view, it's nice to have you know, a video of lameness now, and then we just try and put that away for a couple of months, and then let's reassess them now and then compare the two videos, and let's see if there's been improvement or deterioration. Or I think now that we're unfortunately forced into this kind of more technological world, we hopefully can use some of it to our advantage in managing some cases. Are you doing a lot of that? Yeah.
And the problem with something like arthritis is it's a true chronic disease. So it's a disease that kind of, once it's there, it's always there. Now, it's not always a clinical problem. That's what people have to understand. That's one of the really strange things about arthritis. It's not always a clinical problem. And that's why it's important to be able to measure and gauge how the dog is day by day, week by week. And it's important to keep an ongoing record of that. And the owner so much is the best person to really be in charge of that record, because we're trying to look for a baseline. I mean, again, going back to the human, it's interesting because arthritis pain is chronic pain. It's a mixture of different types of pain, and that's why it manifests itself differently, because we've got the kind of the pain that we're all very aware of, which is kind of, if I touch a hot object, I get burned, and there the pain protects me because it tells me to take my hand away, and that's kind of like it's either like it's receptor pain. It's where there's a signal and there's a receptor, and then I respond, and that's kind of the pain that we're very used to. But arthritis, unfortunately, is a combination of that type of pain, which gets a little bit mixed up, and a non-receptor type of pain, where the whole pain system becomes changed so that it doesn't need that stimulus to be painful. And that's what kind of changes what the patients feel. And the way humans describe it is, early in the disease, they get a lot of episodes of really, really obvious pain. So they think, oh, my knee's sore, you know, and they limp. And then that wears off. That's usually because they're doing something, they're either exercising. And then that gradually is augmented by another type of pain, which is this kind of throbbing pain that they describe. So it's two distinct types of pain, and it's a mixture of both that produces the signs that we see. And when humans, at least they can describe that. But when we look at dogs, we've got to try and spot that. And whereas the obvious pain is easy to see, the throbbing underlying pain is much harder for us to identify. And I think that's where, when we start looking for signs of pain, we've got to be aware of these two types of pain. And it's interesting because, and here's the first thing, we talk about lameness, and a lot of people don't understand that lameness, when an animal's lame, almost invariably, it's in pain. I've had so many people come in and say, the dog's lame. That's okay, it's limping, but is it in pain? No. I said, well, think about the last time you limped and why you limped.
I always say, where I try and say this is a bit of a joke really, but there's only two reasons why your dog's going to have gone lame. Either it's painful or suddenly one leg's gone shorter than the other. And I know it's silly, but I think it's just putting it into perspective. And okay, there are cases where you may have post-surgical, there's some kind of mechanical change, but in general, with a healthy dog who one day wasn't lame and the next day is, the only reason they're going to limp is because of a pain response. Yeah. I just wanted to go back over the two types of pain. And I think I like to think of it as an adaptive and a maladaptive pain. So your sharp one where you've burnt your hand, that's the one your body's using to try and protect you and learn from it, and you heal. Whereas the chronic horrible pain, there's no real benefit to that other than it becomes its own, almost like its own disease process, doesn't it? And that's the one. Not that we don't need to treat that adaptive pain in the case of a lameness or something, but the maladaptive pain, that chronic pain, can cause so many problems. Could you just explain a little bit about how the pain can sort of worsen and wind up?
Sure, and I think that's maladaptive pain is the correct name for it, because it has no purpose whatsoever. Yeah. And really, the way I always think about the problem in an arthritic joint is that you've got the normal sensory type pain, so cause and effect pain. And so what's happening in the joint is that there's something going wrong, and it's hitting the little sensors or receptors and telling the brain that there's something wrong. That's pain. But that should switch off and switch on. What then happens is, because that doesn't go away, because in an arthritic joint, once the pathology of deterioration starts, it keeps on going. So there's always the reception keeps on, the stimulus keeps on being there, the signals keep on being sent, and the body then changes, because the body does a couple of strange things. Rather than ignore it and say, look, this is a real pain, excuse the pun, it's I'm feeling this all the time, so it can't be important. It does the opposite. And what we see is, we see changes in the number of sensors inside the joint. So the body produces more sensors.
Yes.
It also then changes the wiring, so that it almost puts a better wiring system in place to take these signals to the brain. Yeah. And I always say the problem's in the joint, but the pain's in the brain.
Yes.
And it's what happens to that signal as it's taken to the brain that causes the problem. Because in a joint which has got a well-established arthritis, the pain system has become so sensitive that really small changes within that joint make the brain think there's a lot of pain there. Now, the other thing that happens with this is, because the whole nervous system is changing, sensitization produces strange effects, in that suddenly structures all around the joint become painful, because the signals that are coming from there, if a muscle contracts and sends a signal to the brain, it should just say, hey brain, I'm just contracting here, so that you know. But when the joint's involved and is an arthritic, that becomes a pain signal. So the brain thinks that the muscle is painful. And that's why that suddenly the thing comes from something which is cause and effect to something that's a problem most of the time. And even normal movement becomes painful. And that's when it really is an issue.
Yeah. Yeah. And then you get the secondary compensatory mechanisms, and, it just is a downward spiral unless you can step in and do something about it. So what sort of behaviours would you see that might indicate that there is pain present?
Yeah. So I think, and if we understand, so we've got what's happening in the joint, what's happening in the nervous system, and what's happening in response, and that's the compensations. That's, I've got to stand in a slightly different way, so I've got to use this muscle more than I should do. and that in itself produces a different type of pain. So we're looking for a whole different almost spectrum of signs. So the obvious is the acute episode where the dog becomes lame. If you touch the leg seems to be painful. If you try to move the leg seems to be painful. And an acute episode, so that's straightforward. We can all know that that's certainly pain, and that should disappear within days. And that's the important thing. It should disappear very quickly. And that's normal in arthritis. That's what happens. Then we start looking for the low-grade pain, which is that's starting to go into the grumbling, throbbing type pain. And what happens there is, if you listen to what people with arthritis say, they say that it is like a throbbing. Sometimes it's like a tingling. Sometimes it's like a numbness. Sometimes it's like a radiating heat pain. And you can see perhaps dogs would respond to that by maybe licking or biting at a joint. So that's kind of direct response to that. Maybe biting the foot more if a dog's got a problem in a joint higher up. But also, again, in people, what they do is if they have a lot of acute episodes, what happens then is they actually spend a lot of time trying to avoid these acute episodes. And so you can see the dog thinking, if I do this, this is going to be sore. And so they don't want to exercise. They change their routines. So maybe the bed that they loved forever is a bed that they won't go into anymore. They don't want to go up or down stairs, perhaps. And these things all can be quite subtle. And over a period of time, you don't really notice that change. But if you take a snapshot at one point, a snapshot 6 months later, it's a completely different dog.
Because it's so gradual. Things like initiating play. So you might still go and play with your dog, but if the dog always used to bring the toy to you and they've stopped doing it, it's such a small sign. But those sorts of things can be really, really important, because that's the dog choosing not to do a behaviour that it's always loved doing. It's choosing to avoid something that it enjoys because it's so painful. So you are right. Those subtle signs are so important. And I always say, I don't know what you think, but if you've had a dog who's always been a certain way and then you've noticed the behaviour has changed, I would always want to investigate for pain at that point. It doesn't matter what the behaviour is. It could be anything. Greeting you at the door, or taking a chew off to go and chew that and it's just stopped doing it, sleeping in a different place like you said, or in a different position sometimes. So a dog always used to curl up and now they'll only lie flat, and can be really, really subtle changes. And then you get to like the neuropathic side of pain, if you don't mind speaking about that a little bit.
And I think that, and again, it's important, that's why it's important to understand the pains coming from different sources. It's not just a severe problem in the joint. It can be a very small problem in the joint. And neuropathic pain is, what you're getting there is really it's an exaggeration of it's pain when there shouldn't be pain there. That's the easiest way to describe it. If anyone's ever had a back problem and had a trapped nerve, that's neuropathic pain, and you can know how searing and horrible that is. Now, as part of that, and again, as part of that whole syndrome, if you have a trapped nerve, as you're recovering, sometimes you get these other things, which are the tinglings, which keep you awake at night, or the heat, cold things. Now, these are the things that we're looking for in dogs with well-established arthritis, because these are the things that can produce quite bizarre signs that we don't expect. But they can, in their own way, that they're just as serious. And kind of the important thing for us as people who are trying to do something about this, vets and owners, is to spot these things and then understand what they mean.
Yeah.
Because once we know what they mean, we can do two things. We can keep on measuring them to see if things are getting better or worse, and we can do things to try and alter them. But without knowing what we're dealing with, we're shooting blind. And I think that's why it's important that we work as a team to try and get as much information as possible to then, and we can talk a little bit about treatments, but I've got this big bugbear that, you know, people spend a lot of time analysing what's wrong with arthritis, then they pick the thing that they like best when it's not appropriate to the problem at all. Because part of the analysis of saying, right, this dog's got this problem, this dog is this particular type, this dog's got this stage of arthritis, this dog shows pain in these. So this is the type of things we've got to treat. And these are the things that treat that. Not this dog's got this, and then here's my favorite arthritis treatment. This is what I'm going to use.
Yeah, so it's a targeted approach to the individual patient, isn't it? That's really important. Yeah.
Really
there's been a couple of little good questions that are quite relevant, so I'll just pop them up. Look, so Lorraine said, my dog does limp and her leg shakes and she never shows it emotionally. She's very hyper and always appears happy, playing and bouncing about. Why would this be if she's clearly in pain?
Well, I think, I mean, again, every individual's got a bit of a threshold. The fact that the dog's limping means there's pain there.
Yeah.
The fact that the dog wants to play means that it thinks playing is more important than the pain.
Yeah.
And you know, we think about ourselves, we do sport and we'll sometimes play when we're sore because we like playing. And dogs are exactly the same. And that works up to a certain point, because as the dog gets older or the disease gets worse, then the balance changes.
Yeah.
And the pain gets worse. I think the question with that is, first of all, accepting that it is painful, but the dog loves playing. So it's just kind of getting the balance right. And I would think that everything's fine as long as the dog is not more lame after the play, because that's one of the signs we're looking for. That then, you know, because one of the things we've got to try and think about is how much exercise should a dog have. And I think one of the signs is if things are worse after exercise, that's probably overdone it. Yeah.
And I guess it's being careful with what type of exercise you're doing as well. So you're not giving sort of repetitive strain. So ball play and things can be quite damaging. I think in this circumstance, in a person, this would be easier to measure, but we're talking about pain versus suffering. And it sounds like during these instances, the dog's pain is still the same as it always is, but because it's having so much fun, it's not suffering. So I think just trying to distinguish between the two, with the suffering being the emotional component of that, so the dog's still really happy. But we do actually see some dogs, sort of Springer Spaniels and things, where when they're painful, they become almost more hyperactive and they can run around more. I think it's a distraction process, or when they get the adrenaline, maybe it overrides. It's difficult to say, but have you had that with some of your patients where they're almost hyper?
And I think these are really good points, Esme. They're really good points, because every dog's slightly different.
Yeah.
And that's why we've got to try and pick these things up. And again, what I'd relate that to is, again, the early stage of arthritis.
Yeah.
Again, and we can relate that back to the human and say, in the early stage, we know that what happens in humans is the pain occurs during exercise. But at that point, it's not debilitating. It's like warnings. It's when the pain's there all the time.
Yeah.
That's when it becomes much more of a problem.
Yeah.
And I think you're right about adrenaline as well, because, you know, it is a distraction, and it does counter the pain in a sense, especially if that pain is not really high grade pain, it's fairly low grade pain.
Yeah.
And we all know, if you, sometimes my dog's a flat coat retriever, yeah. It's got one neuron. And so if you hold food up, pain disappears from that neuron.
Yeah.
There's just distraction, or if she sees a rabbit or she sees a deer or something, that's it. There's no pain.
Yeah, I can understand that. If I've got a sore knee or something, it's not going to stop me wanting to eat that cake. So I can see where she's coming from.
Yeah.
On that side of things. I'll just have a quick look through before we get behind on any questions. Rosemary said, I think that owners that suffer from chronic pains seem to have a better understanding of their dogs. I think that's true. You just take from your own experience.
Very true, yeah.
Helen was asking about what signs of pain there are, and we've gone through a few of them. Basically, anything that's a change, I would say. The neuropathic pain we haven't talked about, though. What would be your the things that you would think, oh, okay, maybe that's a neuropathic issue?
I think specifically something that looks more painful than it should be is kind of a giveaway. It's, if you've got a situation, and I guess we kind of got a picture of the pathology, and if something looks much more painful than it should, then that's a sign that that things have been turned up. The biting, chewing thing is another thing. If we palpate the leg and it seems again much more sensitive than it should be, is another sign. We talked a little, another behavioural thing which I'd forgotten about, is aggression. Yeah. And one of the things we found recently is that a lot of dogs even that are not showing any lameness, with defensive aggression, when they're treated with painkillers, because then they've found if it's arthritis, the aggression subsides. Yeah. Which again is just another sign.
Yeah, I see that a lot. I see the old Labrador who always used to like to play with other dogs in the park and now is very intolerant of other dogs, or the new puppy in the house. And the other thing I think is neuropathic pain is they can do almost like the anal gland things where they suddenly shoot forward or they turn around to look at their bum. Or noise phobias can be one, or just general phobias because they get that sudden sharp pain and they associate it with where they are. There's so many, aren't there? There's so many possible changes or signs. But Charlotte's put a really good question here. So should you talk to your vet about treating or managing behaviour changes, or should you seek the help of a behaviourist?
Well, I think that this is where we have to have a team approach. Yeah. And the behaviourist is part of that team. Yeah. I get a lot of my cases from behaviourists when I was doing a lot of joint replacements, for instance. Yeah. Because they'd spotted the behaviour problem was down to pain, and our solution was to remove the source of the pain. Yeah. And that resolved the behaviour problem. Yeah. Now, there's some behaviour problems that are not as a result of pain, and that's kind of where we all exchange views on this. So I think, my view is with arthritis, if we get a painful disease, the first thing we've got to think of is pain. Yeah. Is that why the behaviour is there? And because it's pain, and we can talk about how difficult it is to block some pain, but if it's pain-related behaviour, if we use some kind of pain medication, we would expect to see the behaviour modifying. That's kind of the acid test. Yeah. So if you've got a behaviour and it's modified by a pain solution, then the behaviour is probably caused by pain. And that's the way we tested things before we did anything sort of more dramatic to try and remove the pain. Yeah. And I think sometimes, you're absolutely right, it's about working as a team. I've had cases where they've been frightened of something because they've had this horrible, I assume it's sciatic pain. It's difficult to tell. They can't tell you.
And they said they've had a shooting pain maybe when they've got into their bed, and then we've resolved the pain issue, so it's not doing those funny behaviours anymore, but it's still got a phobia of the bed. So in that instance, it's really useful, because I am not a behaviourist. So that sort of learning to train, I mean, you'd know if you've met my dogs, they're really badly behaved, but learning how to train the dog to not be frightened anymore is something where behaviours can be really, really useful. So I think it is a case of working as a team, but I agree with you where in the first instance you'd speak to your vet and try a pain management program, and then get referred over to a behaviourist if they felt that it wasn't just a pain thing, that it was appropriate.
And the other thing I think is really important, I think, you know, we can talk about all these, and we have been talking about all these different manifestations of pain, excuse me, and we find that each individual dog has a pattern.
Yeah.
And they may not show all the things we're talking about. And it's important not to become obsessed by the variety of these things and look for everything. Yeah. I think you try and pick, and this is about control, to get control of a dog's problem, you pick the things that are obvious, that keep on happening. You try and qualify and quantify them. So you qualify them, we discuss them and say, is that likely to be pain? Is lameness likely to be pain? Yeah. Is kind of turning around because there's going to be a sharp thing happening? Is that likely to be pain? Yes, it is. Then let's start to record that. And week by week, see how many times that happens, what happens after it, what happens before it, and try to understand it. Because that gives us control, because that's our little thermometer to let us know if the dog's improving or not improving, or more importantly, is what we are doing improving things or not improving things. And that's what I really believe we should focus on, is getting that control and making things happen. I spend a lot of time speaking to people who want to talk in lots of detail about all the signs. God, let's go into food, you know, talk about every type of food possible, talk about every type of treatment possible, and that's fine.
Yeah.
But we're not achieving anything.
Yeah. So it's having that objective assessment there, so that you can look at each patient individually and see what their improvement is or isn't. Do you have because there's loads of pain scales out there, aren't there? Is there a pain scale that you prefer, or do you have what's your preference in how to do that?
I think that it's such a subjective thing. It's a hugely subjective thing in humans, and each of us feels pain differently. Yeah. Because we're all wired slightly differently. But I do think there is a lot of validity in trying to get scales that we can discuss, and so that when we say something, it means the same for each of us. Unfortunately, there are some really good owner questionnaires which have been taken from the human field and modified for use in dogs, and they seem to be particularly good. They're being used more and more in research, where we look at pain to try and judge if something is working. But I think they could be equally useful in the clinical field, because it gives us another measure. What there isn't is a good validated vet tool. We don't seem to be able to agree how we measure things, and I think that is an issue. We use a 10-point scale for lameness, but my 9 might not be the same as your 9, and we need to work towards that, because it's, if we could all share that, you know, if the pet owner had the same scale and we're all talking the same language, then suddenly we all would know, and it gets back to this reassurance. If we know that you're paying something that, unfortunately, with something like arthritis, we can't abolish completely.
No.
But we can control it and keep it to a level where playing is more important than being in pain. Yeah. And the other thing that's important to understand is that having arthritis doesn't necessarily mean that a dog's in pain all the time. There's lots of great evidence, again, from humans that 50% of the humans with pathological signs of arthritis have got no clinical signs.
This actually leads me on to a really good question that we've just been asked by Sue Knowles. She said, is there a point in time where the arthritic joint stops causing pain, perhaps during a phase where the transformation of the joint has stopped?
Well, we're now straying into one of the great mysteries of the disease.
Yeah.
And the answer is that this is not predictable. There's not something we know. What we can say is that there are, the interesting thing about arthritis is, because we've got this neuropathic part of the pain response, which doesn't really match what's happening in terms of the stimulus, that some dogs with hardly anything happening can be in a lot of pain.
Yeah.
Some dogs with a lot happening can be in no pain at all because it works the other way.
Yeah.
And what we've got to do is we've got to try and kind of understand why things are happening, and especially respond to pain very quickly and try and get it under control. But the predictability of this is not good. That's why we can't look at an x-ray and say your dog's in a lot of pain, because an x-ray just tells us that the dog's got a lot of arthritis.
Yeah.
And a lot of people don't understand why that is. But that's the difficult thing about arthritis. But the good thing as well, because it means that there's hope that these joints sometimes can be completely clinically normal, even though there's a lot of pathology in them.
And I guess there is a point kind of leading on from Sue's question where the arthritis is so severe that the joint has almost fused. So if there's not rotation or movement in that joint, then it's quite stable and they'll have a pretty profound limp, but that's purely from a mechanical point of view. I'd still say they're probably going to have some element of pain there, but it might be easier to manage than those dogs who have got the very mobile joint that's very sore. I think that's what you're saying there, really, isn't it? That you can't match up necessarily. You just have to take each individual patient and read them and assess them. And I think it's a bit like us as well. I'm a massive wuss, so I would need a lot of pain relief for something that somebody else probably wouldn't. So it's a bit of that pain threshold too, isn't it?
Yeah, and again, part of the pathology is that if dogs do have sensitization, the pain threshold goes down for everything. So it's not just arthritic pain. They've shown this in humans. If you're sensitized because you've got arthritis, and a lot of humans are, then they're more sensitive to heat and any other type of thing that causes pain affects them more profoundly than it would if they didn't have the arthritis. So we've got to remember that as well, and that's why when we try to control this, it's kind of, we've got to get it early, and we've got to hit it hard, and we've got to stay on top of it all the time. We can't just let it do what it wants to do and then respond when it looks bad, which is kind of what we've done in the past. Yeah.
Just having a little quick read through. We've got so many comments. So I'm trying to quickly catch up on a few to see what interesting things have been said. Beth has just said that this is so helpful. I've been obsessed with my dog. Have an impressive record. It's exhausting. Imaging on Tuesday, so answers then. Recording showed me how my dog changed off pain relief though. Once the trend's clear, going back onto the pain relief after the trial. So I think it is a interesting thing, isn't it, to see how different dogs are responding to different pain reliefs. Has there been, do you know of this? I don't know. Has there been any research into individual pain tolerance levels in dogs?
Not a great deal of research. Most of this really has been translated from human, and it's a difficult problem in humans as well.
Yeah.
Because it's so hard to identify exactly what this is in a kind of scientific environment where you can consistently predict what's happening.
Yeah.
But I think from experience and observation, you know, as clinicians, we can see this.
Yeah.
When we see different dogs in different situations, you can see there is a different tolerance. No doubt about that at all.
I think you see that a lot in vaccination, don't you? Sight hounds can be particularly sensitive to needles, and injections that aren't supposed to be stingy. Sometimes in some dogs where you've given it 100 times and it's never had a reaction, then one dog will just find it incredibly painful for no reason. So we do see that. But yeah, it'd be lovely to have some research on that, but it'd be quite hard to do in a...
Hard to do, I think, yeah.
So I'll just have a quick... So Jolene's just said that her 8-year-old spaniel was x-rayed 2 weeks ago as he had abdominal issues, and they found out he had pancreatitis. While x-raying him, they discovered spondylosis with the lumbosacral area fusing. Her question is, will he be in pain all the time, or good and bad days? Okay,
well, I mean spondylosis is an interesting thing in dogs. There are many dogs, especially boxers, who... Boxers have a lot of spondyles, and they are completely benign. You know, so you'll see a lot of changes on X-ray, and they really don't cause any major clinical problems. However, if you get a spondylosis at the lumbosacral junction, it can indicate that there is a problem with that particular junction, and that we can get something akin to sciatica. Now, again, that's usually quite obvious. They're quite distinctive signs that dogs will show, and there are tests we can do, clinical tests, which can identify that there's pain. You know, in these dogs, they often have very sensitive adductor muscles, so you can pinch the adductor muscle and you get a very obvious response. They also don't like their spine being flexed and extended. So the important thing there for Jolene is the diagnosis is important, because even though that pathology is there, it may not cause a problem. Yeah. Because quite often that's benign. It's a healing process, rather than it's a response rather than the thing that's causing the problem. Yeah. Where you get the problem is either if it actually compresses a nerve root, or what's happening in lumbosacral disease as the main problem is actually within the spine itself, because the cord or the actual canal has become narrowed, and it's actually now squeezing all the nerve roots internally. Yeah. So it's all about, again, the clinical signs rather than the X-ray. Yeah, absolutely. We've had a question about supplements. Are you happy to answer a question about supplements? I'm happy to answer anything.
Brilliant. So Lynn's asked, what are your thoughts on natural medications, i.e. green lip mussel and fish oil?
Okay. I think that, you know, I think we waste a lot of time trying to use things that don't work, rather than things that do work. However, green lip mussel and fish oil have both got evidence that they have some very positive responses in arthritic joints. And there's kind of there's a basic science behind it as well. And people have done research to show there's evidence that if you use them, you get a response. So as supplements go, I think they are strong contenders. And supplements are always interesting because the best way to help a disease is to give something all the time. Yeah. And food is one of these things that kind of can be given all the time. People have got to remember that supplements are not drugs. oftentimes they're almost compared with drugs, but drugs are things that have been tested and have to prove that they do what they say. Supplements, people can actually suggest they do something, but they don't have to prove it.
Yeah.
Or then, because they do prove it, it becomes a drug. It's one of these kind of paradoxical things. But I think that in a balanced management system, both green lip muscle and fish oil, it's got to be the right type of fish oil. That's why a green lip muscle is very good, because it seems to have the right balance of the right ingredients in the one place, and that's why it's so highly sought after.
Yeah.
So these are really encouraging supplements.
Yeah. I think my understanding of them is that they can help to some extent to the health of the joint, but they aren't a pain relief. So you wouldn't give it in a very painful dog instead of a pain relief, because we know that they might improve pain long term. We don't know, because we haven't got studies to prove this, but perhaps if you were giving the omega-3s for a very long time, that joint might be healthier than it could have been, and therefore you would have less pain in that dog, but it's difficult to quantify.
Well, it's interesting, because I mean, the omega-3s, they actually do interfere and change the inflammatory cascade, so they're actually anti-inflammatory. And I think that's the most logical way. It takes them 4 weeks to get into a situation where there's enough of them to do that, so you won't see any change at all for 4 weeks. Whether they change the joint itself, whether they change the cartilage, I think
probably not.
We don't know, but it doesn't really matter, because if they actually change the inflammatory process, that's often what's causing the pain, and that's actually what's keeping the disease going. Yeah.
It'd be lovely to have some sort of studies on it. As vets, we love evidence. We love a good study. So that's what we'd like a bit more of, really. But it's a tricky one. I think it's one of those where you, if a client of mine was asking me about starting their dog on it, and they had quite a severely arthritic dog, my preference is always to go for like a non-steroidal and the relevant and appropriate pain relief that dog needs. And I always suggest going for a therapy over, if it's a case of cost. If you've got loads of money and you want to spend it and it's not going to harm the dog, then you can do what you want with your dog. But I would always say I'd prefer you to have hydrotherapy or physiotherapy over the cost of the supplement, because they're not always cheap.
Yeah, and I think that's right. And I think, I mean, what we're striving for each dog is we're looking for something where we can control the disease in the long term, so we can try and gradually push it in the right direction. Yeah. But at the same time, when we get these acute episodes, we've got something else that we bring in to stop that. So we've got a little recipe, and that's where the combinations work well. So we don't use anything to excess. We don't depend on one thing. Yeah. We pick out a group of things that will work for that dog and use them together. So many people just want to use one thing. And if one thing worked, we wouldn't be sitting here talking about arthritis.
Yeah. It would put me out of a job, that's for sure. Well, that's the dream though, isn't it? The dream would be to be able to prevent all these dogs from suffering, because it's a horrible, horrible disease. Yasmin's got a question about her 12-year-old English Springer Spaniel who suffers with stiffness in his hocks and wrists. Her concern is the amount of muscle wastage on his hind legs due to reduced exercise in his later years. How important would be building up the muscle again alongside pain relief and physio to improve range of motion, and any tips on building that muscle mass?
Okay, I mean, and again, that's really important. That's where we're looking at cause and effect in a way, because what happens in arthritis is when we get the pain and we get the bad signals coming from the joint to the brain, there are a couple of things happening. The brain feels pain, but also then it sends messages out to the muscles to tell them not to move. Yeah. And we get a lot of atrophy. And that then becomes a kind of a horrible destructive circle, because the muscles are there to protect the joint. Yeah. So when the muscles atrophy, the joint becomes more easily damaged because we've got some fibrosis around it, but it's not as stable as it should be. And so exercise can cause more damage, which causes more stimuli, which causes more response to the brain. And one of the good things about physio, mobility exercises and exercises to keep the muscle tone correct, is it's overriding this signal from the brain, which has got no purpose at all.
Yeah.
Because the brain's trying to protect, but in fact, what the joint needs and what the leg needs and what the dog needs is these muscles to keep functioning properly. And as Yasmin said, to keep the joints mobile. That's interesting. And you actually said it before, and this is an observation. When dogs have got arthritis of the hock and the carpus, especially the hock, I found dogs can suffer quite a lot while the hock is mobile.
Yeah.
As the hock stiffens up, the dogs seem to cope better.
Yeah.
And then that's what you said earlier on, and that's what I've seen all the time. And it's one of these things where they go through this critical phase where the movement is painful, and it seems when the movement decreases, and because they can cope pretty well with reduced movement in the hock and the carpus, it's not the same as having an elbow that it can't move properly, or a stifle that can't move properly.
Yeah.
So I think the answer is, it is important to try and keep the muscles built up, to try and keep some pain-free movement in these joints. And there are lots of ways to do it. Clearly, going to a physio who knows what they're doing, is working to plan, is the best way. Home mobilization exercises are things that are never used, and are not used enough, when owners can actually do this every single day, because that's what physio is about. It's not about going once a month. It's got to be done all the time. And it's finding the range of exercises that suit the dog, and wading in water, whether that's in a treadmill or just wading in water up to a certain depth, again, it improves resistive force. So there's all these things that can be done. All you need is a plan, which is practical and will work. And then it's combined with pain medication or pain analgesic procedures when necessary.
Yeah.
And good diet and keeping an animal the right weight.
Yeah, keeping them fit. I think you're absolutely right about pain management, because actually when we start getting them to do those exercises, it can be really painful. It's like when you've not been to the gym for ages and then you go and you overdo it, it can really hurt. So making sure you've got adequate pain relief on board while you're doing your exercises.
Yeah, great point.
Make sure you do your homework that the physios give you, because the one session you have with them every week or 2 weeks or whatever it may be won't be enough. You need to do the exercises they give you, which is, it's a big commitment, isn't it? It's a hard thing being a doggy carer for a dog with arthritis. It's a huge commitment in terms of your life, particularly if you're having all the things that we always encourage. You're going to your regular vet visits, and you're going to your physio and your hydrotherapist or your acupuncturist or whatever it may be. It's a big commitment, and then to have to do your homework too. So let's have a little look through. Laura Eldridge just put up that there's some research recently published on veterinary and owner perception of pain in different breeds of dogs. So that might be quite an interesting one to look at some point for anybody who might be interested in that. Somebody's just asking about what drug types should be considered for neuropathic pain.
That's a really good question, and I'll be completely honest. This is an area where there's a lot of practice which is not backed up with a lot of evidence. It's logical, and this is a combination therapy where we use things like a gabapentin, which is kind of the classical and probably the one that looks the most interesting because of its mechanism, but it's actually a centrally acting drug, and that's a key thing for neuropathic pain. We're trying to do something to modify the transmission within the nervous system. So things like, and these are anti-epileptics, they are antidepressants, things that modify the transmitters within the central nervous system. Now, the problem with that is they're not out and out analgesics because they are not affecting the cause and effect thing. So they're not affecting the thing that's causing the pain. They're indirect. And if we go back to the human literature, in dogs, you'll use amantadine, gabapentin, amitriptyline, to a certain extent, tramadol, which there are reasons why we shouldn't use tramadol in dogs because it doesn't really hang about long enough to use. And paracetamol, to a certain extent, is a centrally acting. It's not really a non-steroidal. No. The problem with all of these is none of them are licensed for use in dogs because no one's actually done any work or trials to show that they actually do work. In humans, they don't work very well. GABA works really well in neuropathic pain. It's used in a lot of primary neuro problems, tumors, etc. But there's only a certain percentage of the population respond to it. Same with amitriptyline. And I've had my personal clinical trial with amitriptyline because I blew a disc in my lumbar region about 2 years ago. And I had horrible sciatica. I went to bed for a Scotsman. I went to bed and hugged my knee because I had a sore back and didn't get up for 4 weeks. Couldn't get out of my bed. And so I did a whole drug trial. I was trying lots of different analgesics to see what would work against neuropathic pain. And it changed all the time. But eventually I ended up with a problem with sensitization where I had a problem with my foot. I was put on amitriptyline. And as I was doing my drug trial, I was researching all of these drugs, being a complete wuss and nerd. But I found that with amitriptyline, there's only 15% of the human population who will respond to amitriptyline and get some analgesic effect from it. And I was one of them, which was fantastic.
Good, yeah.
But if you translate that to the dog, then we're actually stabbing in the dark. And we're kind of using cause and effect. And in fact, we use a lot more of these in dogs than the humans use.
Yeah.
In human arthritic patients, and that worries me a little bit. And what I think happens, I think it's completely logical. It's a good way to go, but you've got to measure and make sure there's no side effects, and make sure that there's a benefit.
Yeah.
And I think my great worry is that people go complicated with these drugs too soon, whereas a much simpler solution might be a better way to go forwards.
It's just being careful and sensible, isn't it? And making sure that we're starting things at low doses and increasing them gently and all those sorts of things. We did a live very recently with Gwen Covey-Crump, the anaesthetist, and she went through some of the neuropathic drugs. So I think obviously we've probably not got time to go through all of them and like the pros and cons and side effects and things, but that might be a good one to go and have a look if anyone is specifically interested in that. So I just want to bring things back really to COVID, if that's okay. So what would be your sort of tips and advice for people who are trying to manage their arthritic dogs during this crisis?
Well, I think that we've talked a lot about pain, and clearly having a handle on that, being confident enough that you can actually spot when pain's there, being relaxed because there isn't pain there, and that means you worry less and the dog worries less. I think the other two big things are diet, because dogs aren't exercising. And we haven't talked in this, but probably one of the most important things about trying to manage arthritis is keeping dogs normal body weight.
Yes.
And I think to avoid all the problems where people argue about is a dog overweight or not overweight because it's a certain weight, I think body condition scoring is a much better way to do that. And I think we've got a link that we can share with people.
Yeah, we also, I don't think you know, but we do offer a free body condition scoring service through CAM as well, so people can send their pictures to us, and we'll do that as well. It is so important, and it's also really important as an owner not to be offended if your vet's telling you that your dog is fat, because they're not saying it because they're trying to offend you. They're saying it because they desperately want your dog to be super fit, to give it the best possible longevity, because there was a study a couple of years ago, and I think in some breeds being obese cut up to 3 years off their life. I think that was right, which is a huge amount of time. If a dog only lives 15 years, it's a big proportion of their life. If you're lucky, 15 years. It could be 10 years, or it depends on the breed. But yeah.
And the other thing people don't understand, people always want to talk about treatments, and we did a study when I was at Glasgow where we looked at overweight dogs and obese dogs that had elbow arthritis, and for whatever reason people didn't want them on any other medication, so we took them in, we body condition scored them, and we dieted them, and we measured that, and we proved that and it's the same in humans, if you can remove 10% of body weight, you will get, and these dogs are all lame, you will get a huge improvement in lameness and a reduction in pain. And if you had 5%, if you remove 5%, we were picking up a lot of the behavioural changes were disappearing. The dogs were happier. And if you want to quantify that, that's the same as giving a non-steroidal anti-inflammatory drug.
Yeah, it's huge.
It's so important. And people almost dismiss it. They overlook it. They think it's a cosmetic thing. It's not. It's a disease-changing thing. Yeah.
And there's been studies that have shown that the fat that's contained actually is inflammatory, isn't it? It's pro-inflammatory. So
it's not just weight, that's right. It's actually stoking up the whole inflammatory process.
Yeah. So that's a big one to tackle. So have you got any other tips for managing dogs in COVID?
Well, I think the other thing, so we talked about pain, diet, and the other thing's exercise.
Yeah.
Because I guess there are two things here. People always worry about the amount of exercise to take. Well, that's in COVID, it's kind of not been an option. Well, or has it? Because suddenly everyone wants to walk the dog.
I know.
So the poor old dog's been walked by 5 people where it was only walked by 1 person before. And there are kind of ways. One of the good ways, if you're worried about exercise, I've always advised owners, is warm up your dog before you go out. And that means just have a routine where you just flex all of the joints one by one in turn. So it's like a routine. And if you know there's arthritis in 1 or 2 joints, you just kind of see what the response is there. It loosens the dog up, prepares it for exercise. They love it. But then you do that again when you come back from exercise. And if the joints are more painful, you've probably done too much exercise, and it gives you a way to try and gauge how much exercise you should do, which you can do yourself, and it gives you this control again of knowing, and not worrying that you're doing too much exercise. I think dogs that are not exercising, I think spending time just mobilizing joints and just doing the same thing, lying the dog down almost as a plaything, flexing, extending all the joints, trying to keep them nice and supple in the absence of exercise is fantastic. And actually it's kind of quality time. Dogs love it.
Yeah, absolutely. Massage, snuggles, more attention. I always say that the best the best form of pain relief is endorphins, and they get those from snuggles. So you can give them some little top-up doses by yourselves at home, can't you? Yeah, I think that's brilliant. I think you've covered pretty much all the points that I wanted to talk about in terms of corona management. One of the things we say in terms of exercise is I believe we can do more than 1 walk a day now, which is good. But just try and keep your dog's exercise quite consistent, and replace, if you're not walking, the 5, I don't know, you might be doing 5-10 minute walks a day. Some dogs are doing, you know, 5-minute walks because that's all they can cope with. We'll try and keep that consistent. Don't suddenly do an hour walk. Just keep it as consistent as you can, even if it is just doing a game in the garden with them or wandering around. There's all sorts of toys and great sort of enrichment activities you can do with them. I saw a really cool video of this of a box with holes in and someone pushing a carrot through and the dog trying to catch it. And I've seen some great things. People have been really inventive during lockdown. I can't do that because my dogs would just get too fat with all the treats, but there's some really great things out there. So I'm just going to wrap this up now and say a huge thank you to you, Stuart, for your time, for your expertise. I think it's been absolutely brilliant tonight, and thank you to everybody for joining in and for your questions. We really do appreciate your time on cam with us, Stuart.
Well, thank you. No, it's a pleasure. Thanks very much. Enjoy it.
Take care. Good night, everybody.